So welcome everybody. Today we're talking to Dr. Jeroen De Buck from the University of Calgary Faculty of Veterinary Medicine about hypocalcemia or low blood calcium in dairy cows. The transition period is a stressful time for dairy cows, largely due to the increased requirements for energy and nutrients like calcium at the onset of lactation. Low blood calcium is a common occurrence for cows after calving, and today we'll be discussing some of the impacts of hypocalcemia and how to identify it on farm. So thank you very much for joining me today, Jeroen.
You're welcome. I'm happy to be here.
So for my first question, I just wanted to get a little bit more information about yourself. So what is your background and involvement in the dairy industry?
Yes, I'm Jeroen De Buck, a professor at the vet school here, as you said. I'm a professor in veterinary microbiology, so I study mainly bovine bacterial diseases such as Johne's disease and digital dermatitis and mastitis, and I've been doing this for about 15 years. But I have a keen interest also in diagnostics for detecting cattle infectious diseases mostly. And so we've been developing new diagnostics, and one of those diagnostics led us to detecting calcium, and hence kind of our interest now in milk fever or hypocalcemia and how to detect it on farm. So during my research over the last 15 years, I've gotten quite some support from the dairy industry, particularly Alberta Milk has been supporting, funding, and providing feedback on my research, which has been really valuable over the years.
Great, yeah, and I know that we've been happy to support all your different research endeavors over the last few years. So getting more into our topic, can we start with what exactly is hypocalcemia?
So yeah, hypocalcemia is, as you mentioned in the beginning, low blood calcium. And so this happens shortly after, or maybe even around calving. This happens because the cow really needs to produce lots of, in beginning, colostrum and then transition to producing lots of milk, has just delivered a calf, and needs calcium for this, calcium for the milk, calcium for the cow's own metabolism, and this calcium need really triples in that kind of period. And the cow is trying to get that calcium from somewhere. There is not enough to readily kind of absorb this from the diet, from the intestine, or through the intestine, and so the cow has a mechanism to draw this from the bones. However, because that need can be so high, and if the cow is not properly prepared for this, there might be some deficiencies in the blood, which will have effects, I guess several effects that I'll mention. But that's really kind of the setup there. The cow just has delivered a calf, is putting all its efforts towards producing colostrum and milk for the calf to its own detriment to some extent. So when the calcium in the blood is low, calcium being an important micromineral that regulates many functions in the body of the cow, this will lead to problems. For example, because of calcium having an effect on the contractions of muscles, the function of muscles, skeletal muscles, the cow might collapse and that might not be able to bear its own weight. Also, the muscles around the stomach and the intestine will be compromised, leading to, I guess, problems like displaced abomasum, not being able to kind of empty that stomach. That will lead to a lower dry matter intake. Also, those same muscles, not the same muscles, but muscles around the uterus will have an impact on the cow not being able to expel the placenta after delivery of the calf. And this will then lead to retained placenta, maybe metritis. Also, the sphincter around the uterus, the sphincter of the teeth ends might not close because all those muscles basically cannot proper functionally, which will now give an entry port to bacteria, leading to mastitis. On top of all this, it's basically not only the contraction of muscles that's impacted, but also the immune system, because calcium also plays a role, interestingly, on the immune cells, for the immune cells to recognize the signals of infection. And so if the immune system is compromised, and there's, for example, retained placenta or this bacteria entering the mammary gland, this will lead to metritis or mastitis. So there's a whole series of downstream postpartum diseases that can actually follow the low blood calcium. I didn't yet do a good job in kind of separating all those issues, so maybe I'll kind of restart from the beginning, say that there is definitely a difference between clinical milk fever and then subclinical. And so everything I've been saying has been a combination. But the clinical milk fever is where you really see the cow having trouble because of the mostly effects on the muscles. All the other downstream potential postpartum diseases can still happen after clinical milk fever, can also happen when the cow has gone through subclinical milk fever.
Yeah, absolutely. So you definitely talked a little bit already about some of the disease potential and some of the symptoms we might see for hypocalcemia in general. And as you also mentioned, there's a difference between clinical hypocalcemia or milk fever and subclinical hypocalcemia. So if we could break it down a little bit, for clinical hypocalcemia or milk fever, what might producers, directly see on farm that would lead them to identify this problem?
Yeah, so clinical milk fever or hypocalcemia indeed has visual signs that can be observed. If you have skilled workers or when you kind of know what to expect, you can see that this goes through different phases. And so the first phase might be that the cow is restless, shows some signs of weakness, also might have cold ears as one of those, if you pay attention, signs that could be picked up. And that's the first phase. But after that quite quickly, the cow could go to a second or maybe third phase where the cow goes down. And the phase 2 is the cow going down, not being completely flat, but definitely having muscle problems, and the cow is not able to kind of stand up. That might then exacerbate to phase 3, where the cow is completely flat, might have bloat, kind of funny S-shape to the neck, because those muscles really cannot function anymore. At that point, the cow could die fairly quickly after this. So there is an urgency to those phase 2 and phase 3, and there's treatments that need to happen that we can maybe talk about. But then there's the subclinical milk fever or hypocalcemia, where there are no signs because it is indeed subclinical, but there is still a low blood calcium, and there is a certain value, 2.1 millimolars of blood calcium, under which we know that, hey, the calcium is not adequate in concentrations and will have effects on several diseases, on milk production, and so on. So subclinical milk fever you cannot detect with clinical symptoms, and so you need to effectively measure the blood calcium to have an idea, or to know that this is happening and that there will be consequences to this hypocalcemia, especially if it's chronic. We know that this blood calcium drops for all cows to some extent around this around calving, but if this drop is more pronounced, or if it's chronic and it takes several days, so 3, 4 days, 5 days, that becomes chronic, and that's really when the consequences will occur.
Okay, so how big of an issue is both clinical and subclinical hypocalcemia on dairy farms?
So we know that clinical milk fever, where you see clinical signs and the cow might go down, can be up to 5%. Some reports will be say even 10, so 5 to 10 would be maybe not normal, but could be seen. This could be lower in some farms, definitely if there's good management for transition diets, close-up diets, management. If that's done properly, that percentage should be lower. For subclinical milk fever, you might have up to 50% prevalence. So half the cows might actually have lower blood calcium than is ideal. And so there will be consequences because of this. A recent study here in Alberta, actually on a number of farms, demonstrated the percentage of 34% subclinical milk fever. It was done in Dr. Colasso's lab very recently, 2020, I believe. So the range is about 25 to 50% that you could easily find on dairy farms for subclinical fever.
And you touched a little bit on the consequences of subclinical hypocalcemia, but just to get into it more, so that's quite a high prevalence. So we can assume that most farms are dealing with subclinical hypocalcemia. But if it's not presenting with clinical symptoms, is it something that producers should really be worried about, or will it just, go away without them intervening at all?
So yeah, there are indeed a good number of postpartum diseases that will be the consequence of subclinical milk fever, and there are several. There's displaced abomasum, there is retained placenta, metritis, mastitis, also ketosis has been associated with low blood calcium. Of course, also poor motility of the intestinal tract and the stomachs will lead to a reduced dry matter intake, and will then actually lead to a decreased productivity. On top of this, there is also, because of the muscle function and immune functions that are compromised in the uterus, there will be a low fertility. So there is definitely also an impact on the reproduction. It turns out that 70% of cows going through low blood calcium or subclinical hypocalcemia, that they are not getting pregnant through the first service. So that's a high percentage of fertility issues there. Mm-hmm. Culling is also increased for those cows that have subclinical hypocalcemia, and all of this indeed will have a big impact on the bottom line of the farmer. It's been calculated that all those postpartum diseases together will actually cost about $125 per cow that has low blood calcium, $300 for a clinical case. And so this is definitely going to add up. So a 100-head farm can expect to have a cost of about $9,000 altogether per year due to blood calcium that is too low, and that can be managed. It's the postpartum diseases that increase the health of the animals, culling, and then something funny is also going on that I don't quite understand, is that there is correlation between lameness and hypocalcemia. And it turns out that lame cows have a threefold higher chance. So there's going to be 3 times more lame cows than non-lame cows that will have hypocalcemia. And I don't see a connection, but it's definitely an important factor as well.
Yeah, so it sounds like it's safe to say that subclinical hypocalcemia will kind of negatively impact cows across the board.
Yes, and it's a disease that is not visual, so you might not know that this is going on. It's one of those iceberg diseases, as there are several, where if you have one case of clinical hypocalcemia, there is going to be at least 10 that will have subclinical milk fever, and there will be negative effects of this to the overall health of the cow and the herd.
Okay. So focusing a little bit more on subclinical hypocalcemia, because I think most producers are aware of clinical, and when cows go down, it's generally a pretty good sign that low calcium may be to blame. So focusing a bit more on the subclinical, if there isn't symptoms that producers will see, day to day or during their visual health checks, should they just be treating all transition cows as if they have low blood calcium?
Well, it is good to prepare all cows, all transition cows, to not have, metabolic disorders and not to have deficiencies in macro minerals. But that doesn't mean that there is still a difference in how you would prevent hypocalcemia in different cows of different parities. So it is known that cows of third and higher lactation are of higher risk. And so you might prevent clinical milk fever by a calcium bolus. However, backtracking to what you should do for the whole herd, it is good to have good management and to have good kind of dietary management to prepare the cows for producing that and excreting that much calcium in milk, and using calcium from the bones by the time it's necessary. And you can do so by several mechanisms or different kind of changes to the diet. One is an acidification of the blood that is accomplished by diet changes, and that's kind of the DCAT mechanism, dietary cation-ion difference or balance, where you acidify the blood by having more anions than cations in the diet. And this acidification will prepare the cow by allowing the hormones that really regulate the calcium in the blood to function optimally. So that's one way that definitely you can use to reduce subclinical hypocalcemia. It's been reported that you can reduce the prevalence of subclinical milk fever from, say, 50% prevalence down to 15% by just making this change. There is one issue with that dietary management, is that it needs to indeed be followed up quite closely, because it does require some adjusting throughout and measuring that this is actually functioning well by measuring the urine pH. And this is, of course, not the most convenient thing to measure the pH of urine to see that you're doing a proper job. So that DCAT method is definitely one option. There are also options to bind calcium by calcium binders in the diet, so to somewhat reduce the calcium that can be absorbed by the cow, to prepare the cow to mobilize the calcium from the bones more readily and more easily. So that's all. It's all about kind of preparation of the cow. These solutions are working better than just giving calcium when it's needed, because you can give a bolus, but this needs to be high concentration, and it's typically is only going to work for a little while. So you need to kind of follow up that there is enough calcium that's been taken up from a calcium bolus. You can't just give one bolus and then believe that the cow will be fine for the rest of those first days after calving. Yeah, there's definitely other things that could be done, could be managed. For example, getting a little bit more complex into other minerals, microminerals like magnesium and potassium, and how they have an impact on the mobilization of calcium. So having high magnesium helps to actually absorb the calcium. Getting into even more detail, there are but quite important, there are a number of different risk factors for cows. As I mentioned before, the lactation number is one. It turns out that overconditioned cows, so if in that dry period they have a higher body score than, I guess, what is optimal, they have a higher risk for milk fever. The breed of cows, or milking cows, is also important. It's quite well known that Jerseys have higher prevalence of milk fever than Holsteins do. And so there's a good series of, or a good list of predisposing conditions and risk factors that can be managed, at least to some extent.
So I think that's a lot of really good solutions out there for prevention. But I guess for producers who want to be a little bit more involved and actually understand, what's going on their farm, and if they have an issue, now that we know that there's no real visual symptoms for subclinical hypocalcemia, are there methods out there that producers could use to diagnose subclinical hypocalcemia and understand the prevalence in their herd?
Yes, it is important indeed to follow up, especially if a producer would make changes, dietary changes, management changes, to see that there's a change in prevalence from the baseline. So what can producers do? Well, they could take blood samples and send them to a lab. However, there is a time delay. And so you wouldn't want to do this, first of all, for a clinical case, because you need to act fast and you need to know what you're doing. You might still do this to kind of confirm that this was a milk fever case. But that's typically too late and too expensive, if you ask me. We sent samples just recently to, I guess, without naming the lab, to a lab across the provincial border here, and we paid $21 for a single calcium test. There's other labs where this could be done for $15 or so, but that's still, a substantial cost for a single blood sample. But that would be a way to maybe take a number of different blood samples, There are recommendations to do this every month for, say, 10 cows that went through calving to see where you are at in terms of subclinical hypocalcemia that you cannot see, and then judge where you are and see if you can see improvements. But there is at the moment no on-farm test, and that would be the most convenient to be able to take a blood sample and get an immediate readout of whether the blood calcium is below a certain threshold or not. And that is indeed what we are working on to put on the farm as soon as we can.
So yeah, so essentially it sounds like not a lot, in that you could send blood samples to the lab, but that might not be economically viable for producers.
I would want to add one thing, in that the fact that it is fairly expensive to send blood samples to the lab for just calcium measurements, and because you don't observe subclinical hypocalcemia, I believe that there is an underappreciation of this condition, and that we would definitely be better off if we would know what the prevalence is, so that we can kind of steer in the right direction. So if we would have a quick, convenient, inexpensive test on farm, we could really start monitoring our changes and know really what the scope of this disease is.
So you've touched on it a little bit, some of the work that you're doing in your lab right now. So can you tell us a little bit about this diagnostic cow side tool that you're working on?
So we have a solution to measure the concentration of calcium in the blood. What a producer would do is just take a syringe of their preference and a needle, and take a tail vein blood sample, and then immediately drop a few drops of blood into a little bulb that contains our special test reagents. And from this bulb, within seconds, just kind of mix it by tapping, and then you expel this onto a small test strip inserted into our handheld device. This whole procedure, from kind of pulling the needle from the tail vein to putting the blood onto the test strip, takes maybe 15 seconds, and then immediately after you get a result. So it's quite convenient and fast. The other advantage of this test is that the smartphone gets the signal and can kind of capture this data, will assign it to the cow that you just tested, and this will be stored for future reference. We also will provide on our smartphone kind of analytics, a way to analyze this data, to maybe plot the data of this individual cow, but also give you a sense of how the herd is doing with respect to milk fever. Another bonus or advantage of doing this all digitally is that the data can be stored in the cloud, and any user on farm can, with their own cell phone app, retrieve that data and look at it. Producer might also decide to send it to kind of the farm support nutritionist, or maybe veterinarian, to take a look at how management changes have impacted maybe the overall prevalence of milk fever, or something else like this. You might also, as a producer, want to look at a cow, or know that, hey, cow is about to calve, and look at the data that was captured last year or last calving, to see whether this cow had any issues at that point. And so I guess more frequent testing, which would be doable with a not expensive test, would generate that data that would definitely help the producer make decisions and assess how they're doing with managing milk fever. Those are kind of the highlights of the test that we're working on.
Yeah. So at what stage of your research are you in? Like, do you have this physical device already? Like, is it,
yes,
you've tested it, it's ready to go?
Yeah, actually, we have done plenty of testing, of course. We have all the components, and it's integrated and it works well. We are at the moment now doing on-farm validation. We have done, we have developed the reagents, we have developed the handheld device, we have the cell phone app. We're actually starting to manufacture our devices right now. We have those reagent chips, if you want to call them this, kind of ready to go. We want to capture or do a thorough on-farm validation on several farms, so that we have good test characteristics. But all the other components are really already accomplished.
Yeah, that sounds great. So it sounds like this is a tool that producers will be able to purchase. So is it expensive? Will it be cost per strip, or how does that work?
Yes, so it will be a reusable reader or meter that we would sell around $150 or so. And the actual tests will be one-time tests that we will sell for around $5 a test. So definitely much lower than what you would get in a standard lab, and with the convenience, of course, that you could get the result in seconds. It will be very convenient. So we worked very hard on making this a not cumbersome test with many steps, but very straightforward and fast test to get the results right there on farm next to the cow.
So for the future of this meter, is the focus just on blood calcium, or is there other things that you're looking to incorporate?
Yeah, that is a good question, because indeed the plan is to develop one device that could measure several different diseases of dairy cattle. And so we've been working on several other tests. One of the tests is for mastitis, where we are detecting biomarkers of mastitis that are definitely of use in many cases. One particular use case would be before dry off, to see that whether or not there is kind of an infection brewing that will lead to mastitis. The biomarkers of mastitis that we're detecting are very useful for this. We also can detect antibodies for infectious agents. And so we have an application that isn't kind of fully developed, but definitely has good results already for detecting bovine leukemia virus, penside. We can detect also total immunoglobulins in colostrum, and this might be good for colostrum kind of management, both immunoglobulins in the colostrum and also in the calf. We also want to add ketosis testing to this device. Although ketosis tests do exist already, we definitely want to provide a one device that can do as many different things as possible for the convenience of the producer, not having to use kind of different tests and solutions. And I always think of all the remotes that I have in my house. Like, it's really difficult to know, and sometimes you're using the wrong remote pointing at your or TV or so. So we want to basically consolidate all the different tests that could be done to a single device. And we keep adding new applications to this platform of tests for the dairy producer. The first test will be the one for milk fever or hypocalcemia. And so then we're going to add on new tests with kind of disposable single tests for every other disease afterwards. So yeah, so that's the long-term plan.
Okay, and so would that just be like it's the same device but different test strips that are able to measure different things?
Yes, exactly. So you could, for example, imagine for mastitis that we want to take a milk sample, and in that case we'd have a plastic chip, disposable chip specifically for detecting mastitis, sorry, in that case, where you would dip the chip into milk, and the reagents on chip would then create that signal. It could be read by the same meter. Milk fever is a little bit different. That will have kind of a little plastic bulb for the blood sample. So the solution will be somewhat specific to the disease in terms of the test chip, but not the device. That will be the same. Mm-hmm. I also forgot to mention, in the applications might be of interest, we are working, and this is earlier stage of development, in detecting the actual causative agent of mastitis. So not just whether mastitis is present, but we're hoping to detect different pathogens, the different bacteria causing mastitis. So whether it's a gram-positive, say Staphylococcus, Staph aureus, for example, or it's E. coli, we'd like to differentiate this on farm, which is difficult to do at the moment. And that will take a little longer, but you see how we have ideas to add more tests to the same device, the same solution. So.
Well, it sounds really impressive, and I think the more that it can do, the more useful and effective that it becomes for producers and kind of that whole herd health. So I guess that ties into kind of my final question is, now that you have this product under development and well on its way, how do you envision this tool being used on the farm in the future? Like, what's your ideal outcome for this product?
Yeah, the ideal outcome for the product would be that there would be one or more devices on a farm where indeed the producer would have decided which diseases they want to detect on farm, pen side, and then the training would be minimal, but several people on farm could apply these tests, whether it's going to test on blood samples or milk samples. All the data would be kind of captured onto not just one device, but since it's cloud-based, all users can have access to this. The longer term plans is to really develop the data analytics so that we can start predicting the health of the whole herd or individual animals based on many inputs. The more frequent testing is done, the more different diseases are being detected by the same device, the more data there is to play with. We also want to integrate the data that we're producing with data that's already present on farm, right? DairyComp has a lot of data already accumulated. We already are kind of extracting the data from DairyComp to allow our app to function well and to assign the new test values to the cows and things like this. But all data coming from robotics on farms, robots, milking robots on farm, could also be integrated with our app so that it would be eventually one platform. This is kind of a longer term dream, that we provide kind of convenience and not just another set of data to look at, but that there's integration. So to kind of summarize, the vision is to enable telehealth, which means that the tests are being run on farm where it's most convenient to do, and there's no waiting times, but the data is available to all people that want to have some insight into how the farm is doing, the nutritionist, veterinarian, the producers, and all accessed in a similar way and kind of in real time. And then a complete data integration, as I mentioned, is also kind of the plan. Since we're mostly talking about milk fever here, the goal is, of course, for our test to help farmers to reduce the prevalence of milk fever, subclinical milk fever, and also clinical milk fever. I can talk a little bit about this that maybe could kind of put into an earlier section. If you can reduce overall prevalence of milk fever and low blood calcium, you'll deal with lots of those postpartum diseases that will be costly and will keep you busy on farm. I didn't talk too much about how our solution can help in manage clinical milk fever. I've been kind of focusing on the subclinical, which I think is most important. But it turns out you can also predict clinical milk fever to happen in certain cows by measuring blood calcium before calving. So there's a certain value. If it's below this, there's a higher chance that this cow will basically have low blood calcium after calving, which kind of makes sense that this would be correlated before and after. But since there are treatment solutions for clinical milk fever by, for example, giving, or for prevention would be giving the calcium bolus, or as treatment you'd give an IV if the cow is really down, IV calcium. These solutions are good and effective, but not on the kind of longer term. They're really good in providing calcium right there for the cow to do better, but that doesn't mean that the calcium is now stabilized. And so you need to kind of follow this up to see how the cow is doing after a day or after 48 hours. And this could be done now with our solution of detecting blood calcium right there. So you cannot send a sample to the lab and wait 2 days for the result for you to kind of assess that result. So I think our tool will also help to better manage clinical cases. I didn't kind of specify that before, so it's a plug-in for somewhere.
No, that sounds good. And so there's application, after calving specifically for diagnosing the issue, but also applications before calving for ideally predicting which cows might need more attention.
Yeah, exactly. And the monitoring of the state of the cow and the blood calcium in all these scenarios can be important. So an add-on is that there is some reports, and they're anecdotal as far as I know, of even high producing cows. So those cows that are really valuable to also have issues mid-lactation. We always think about milk fever more as an post-calving issue, but there might be subclinical milk fever or low blood calcium during lactation. So if there's a very high producing cow producing lots of calcium in the milk, this might maybe cause an issue. And so there's not more research need to be done there. And so our tool will also allow to see that maybe subclinical milk fever is a bigger issue than that we realize. If you don't test regularly, it would be harder to discover this. So.
Yeah. And I liked what you said earlier too, that it's about understanding the prevalence on farm, but also about understanding or evaluating your management techniques. Yeah. So if you're applying different diets or boluses or whatever you're doing, you now have a way to measure if it's actually working for your cows.
Yeah, exactly. Because you're going to be spending time and money on those management changes or implementations or products. And so if you want to know that actually things are improving, otherwise you might decide for another solution, or might decide to do it better or with more, I guess, more focused.
Yeah, and that certainly has the same applications, you know, if in the future it's measuring mastitis or BLV or whatever else you have, or whatever else you're able to measure. So I think it's important for, prevalence and diagnostics, but also evaluating management.
Yeah, I believe so too.
Okay. Was there anything else you wanted to mention that we didn't cover yet?
No, I think we covered quite a great deal of topics related to this diagnostic, but also milk fever in general. Mm-hmm. So I'm good.
Well, thank you very much for your time.
All right, good. Thank you, Kieran.